Welcome back. Today, we're diving into one of the biological approach therapies, psychosurgery. So, what exactly is psychosurgery? Simply put, it's a type of brain surgery used to treat severe mental disorders. Psychosurgery is based on the medical model of mental illness. This model views mental disorders as biological issues in the brain, which, in theory, means we can treat them physically, just like we treat a broken bone or an infection. The main aim of psychosurgery is to change dysfunctional brain circuits that are causing mental health issues. By targeting specific areas of the brain, the goal is to relieve symptoms when other treatments haven't worked. Remember, it's usually considered a last resort due to its invasive nature. First up, the transorbital lobotomy. This procedure involves inserting a sharp tool, known as an orbitoclast, through the eye socket to reach the brain. It's then moved to cut connections in the frontal lobes. Transorbital lobotomies were used to treat severe conditions like schizophrenia and depression, but they often caused significant personality changes and cognitive impairments. As you might imagine, this method is no longer practiced. Next, we have the prefrontal leucotomy, another type of lobotomy. This involves drilling small holes into the skull, usually close to the temples, and using a wire loop, called a leucotomy, to cut into white matter in the prefrontal cortex. The goal was to reduce symptoms like aggression and agitation, commonly seen in schizophrenia and other mental health disorders. Moving on, we come to bilateral cingulotomy. This is a more modern form of psychosurgery that targets the cingulate gyrus, an area associated with emotion and behavior regulation. Surgeons use a technique like radiofrequency waves to create small lesions in this area, aiming to interrupt problematic brain circuits. Brain scans, like MRI scans, will be used to accurately target the problematic areas of the brain. Bilateral cingulotomies are often used to treat severe, treatment-resistant cases of OCD and chronic pain. This method is far more refined than lobotomies, and side effects are generally fewer, although they still exist. Finally, we have deep brain stimulation, or DBS. This isn't quite surgery in the traditional sense, but it's very targeted. DBS involves implanting electrodes into specific brain areas, often the areas that control mood and behavior. These electrodes are connected to a device, like a pacemaker, that sends electrical impulses to modulate brain activity. DBS has shown success in treating disorders like Parkinson's disease, depression, and OCD. It's minimally invasive compared to earlier methods and allows doctors to adjust the stimulation level as needed. To sum up, psychosurgery has evolved over the years, from crude and risky lobotomies to much more refined, targeted techniques like bilateral cingulotomies and DBS. Each of these methods reflects the medical model's view of mental illness as a physical problem in the brain that we can address with surgery. Thanks for watching. Don't forget to like, subscribe, and hit the bell to stay updated on more psychology content. And if you have questions, drop them in the comments below.